But today on our health segment, we are discussing I want to call it a very sensitive topic. Most men are shy to talk about it. In the long run, women who are with them are affected, and it really causes a problem for both parties. Today we're talking about erectile dysfunction, and we have Dr. Senyo Misroame to help us understand what erectile dysfunction is, the impotency, the myths around it, and all you should know about it. So you could send your questions to us, and we'll put them to him for him to profess some solutions if they can be. All right. So thank you for joining us, Doc. Good morning.
Well, good morning, Zoe. It's good to be here with you.
Great.
I'm happy. Hey, I think that they just choose beautiful women to host me anytime I come in. And of course, Spikey is a handsome one too. So
thank you.
Good to be here always. Erectile dysfunction, big one. I like your intro. It's a very sensitive issue. Sometimes some people find, the guts to joke about it. In some sense it's good. In another sense, it's not so good. If in Ghana, even in our local parlance, when somebody has erectile dysfunction, we say "abayaji utu." The law has taken your gun, or you've lost your power, or you are no more a man, and all of that. So that alone makes the topic, a difficult one to discuss. Because who wants to come and say that I no more have the male power, or the law has taken my gun, I can't shoot anymore, and stuff like that. So it's really, really sensitive. But we just need to understand what it is. Now, to understand erectile dysfunction, you need to get these two words in your head: attain and maintain. Okay. All right. So inability or difficulty in attaining an erection and maintaining it.
So in other words, there are people who are able to get the erection
and
but
are
cannot
able to
keep it.
maintain it for sexual satisfaction or for whatever purpose they want to use it sexually.
And the others who do not have it at all.
And others who cannot attain it at all. Okay. So both of them have erectile dysfunction. It is said that it's allowed for men to have one or two no-shows. So for instance, if you're a guy who performs all the time, and then just one day out of the blue, or maybe once in a while, you are not able to attain and maintain for the purpose, those are not the people we are talking about. So it's allowed once in a while. Now, if it is a problem for you each sexual encounter, then we have a problem. And it is said that, like 1 in 10 of all men have this problem. So it's common, 10% of men have this problem. And then as you age, the percentage goes up. So for instance, let's say before 40 years, 10% of men could have this problem. From 40, 45 onwards, the percentages go up. So you get to like 70, where in Ghana, most people will be like, 70 years, what are you even looking for? And you were asking me this before the show. And I'm like, look, even at 90, if I do get early morning erections and I'm strong enough, I should be able to enjoy sex, unless there is a reason. For instance, I have a heart condition or something that would not make me partake. But otherwise, once your organs and everything is ready and you have a receptive partner, everybody should enjoy sex.
Okay, so it could happen once in a while.
Yes, which is allowed.
Which is allowed. But when it happens, today, tomorrow you're able to attain and maintain. The next day you're unable to. Is there a cause for worry?
Yes, there is. I'll just take you through how a man gets an erection. Then we can look at the various levels and then see which ones are worrisome or are worrying. Before you get an erection, you need to get impulses or stimulated. And the stimulation comes in many forms. Not what you see, what you hear, what you smell, and even sometimes what you imagine. All right, so for a man to have an erection, he needs to have an intact brain and the brain's mind. By now, we know that the brain is a structure and the mind is the many complexities that we can form around, all right? So now that brain has to be intact to be able to receive such stimulus or create such imaginations, right? Now, once that is there, the body uses two mechanisms to send messages down to the organ which is going to get erected, which is the penis. Now, the brain uses chemical messengers, which are released into the blood, and then, of course, the blood has to flow and find its way towards where the penis is. And then these chemical messengers will cause changes that will open blood vessels that will make the blood pump into the penis. All right. Now the penis has 2 barrels that blood can go into. They're spongy with spaces that blood can fill. And then I say that there is a valve that opens at the end of the barrel for blood to fill. Now, once the blood fills the penis, it starts getting erected and erected and erected. When the blood is full up in the penis, these 2 valves will close, and then you can partake in sexual intercourse. Now, it's important to hold this thought, okay? Now, the second, mode of sending messages is the spinal cord, okay? So the brain also sends electrical impulses through the spinal cord. The spinal cord takes these messages down to the level where the nerves come out, to supply the penis. And these electrical messages reach there and then give the penis extra sensation, more blood flow, and all of that to get an erection. So by saying this, you need a brain, you need an intact spinal cord that releases electrical messages. The spinal cord should work well to the level where there are nerves that go to the penis area and all of that, including muscles that are in the region and all that. So you need to have an intact pathway, both for blood and electrical impulses for you to have an erection. So if you have a problem at any of these stages, it's cause for worry. Okay, so
if I get you, if a guy has a psychological issue, it could affect his ability to attain.
Yes.
And for instance, people get accidents. So if you have a problem with your spine, it could also affect it.
Absolutely, it could.
And it could be permanent or temporary.
Well, so if the injury is permanent, then it means that, by now, I'm sure you know that when you have a spinal cord injury or a nerve injury, it takes long, for the nerve to heal. Sometimes not at all. And so you'll be going for physical therapy and the rest, to be able to perform certain functions. So if the spinal cord injury is permanent, then it means that you cannot attain an erection using this mechanism we spoke about. There are other ways. Of course, human beings always like to circumvent our problems. So there are other ways of helping you get an erection. Hopefully, your spine should be okay for you to perform sexually when we give you that erection.
So if you are stressed, it can affect you?
Yes, if you are stressed, if you are worried, if you have emotional, financial, let's say just social and economic problems, and your brain is constantly occupied thinking about these things, trying to solve other problems, then that aspect of the brain that is concerned with giving you pleasurable thoughts and then, of course, releasing these hormones and chemicals that will make you have the erection are affected because one part of your brain is very busy, dealing with these things. And those emotions or the problems that you have or the stress can dampen the way the brain releases these electrical impulses. So you see that a man who is super, super worried, thinking a lot, the last thing on his mind, or even if he wanted to, will be erection. But having said that, I was telling someone the last time that when men and women are bereaved or they are mourning, that's when they tend to have more sex. There's another aspect. When you are worried and you get companionship, somebody who is compassionate and talking to you and calming you down and the rest, it opens another part of your brain that tells you that you are being pampered, all the feel-good hormones begin to release. And then if they are able to overshadow the stresses, then your sexual, appetite, or let's just say your libido, will go up, and then that will inform all of these things to come. So don't think that, when you are sad, you can't have sex. Because I know people who get pregnant usually during funeral periods because they go to cry, but all the sympathy and people talking nicely to them and the rest makes, their sexuality also, come up more.
Okay, so apart from these two, are there other causative factors that will make a guy not function or
impotent?
Impotent.
Yeah. Well, so apart from the brain and the spinal cord, we spoke about blood flow. So, for instance, if the blood vessels that carry blood, down to the pelvic area are blocked, then obviously when you are called upon to have an erection, either the blood will be flowing too slowly down there or there will be not much flow at all. All right. Now, what can cause these things? When people have high cholesterol and the cholesterol plaques the lumen or the inside of the blood vessels, then it means that the area for blood to flow through is smaller. Okay, now people also smoke, and smoking we know can narrow blood vessels, and smoking we also know can reduce the release of some of these chemical messengers we spoke about, and the biggest of them is nitric oxide, which opens blood vessels up. So if you have problems with your blood vessels, this can happen. So smoking, diabetes, high cholesterol, all of these can affect you. All right, and then I'll add another one. We said that blood flow will cause an erection, and we know that the biggest pump in the body that pushes blood around is the heart. So if you have a weak heart, you are not likely to get good erections. Or even if you do, you suffer a lot because the heart has to pump a lot. So some people will tell you, anytime I get an erection, I get palpitations, and then all of a sudden, I don't know what happens, and I lose the erection and all of that. So a man needs to improve his general health status. Your heart has to be pumping well. You need to have muscles, that can make you stand and perform and all that. So men who do not exercise, men who put on more weight, men whose cholesterol is high, men whose hearts are weaker and all of that, most of these people will be adding up to the statistics of people who have erectile dysfunction.
Okay, so we have Dr. Senyo Misroame, who is the director of the Tantra Community Clinic here, and our topic for today is erectile dysfunction. If you have questions, you can send it to us, like Charles in Kaswa has done. He says, good morning to you. I want to know, if you are above 45 years and cannot have sex for a long time, what is the solution?
All right, so having sex for a long time, the term long time is relative. Like we said, attaining and maintaining an erection for sexual performance, which is satisfactory to both you and your partner. Now, there are many women who don't even enjoy sex for a long time. If you ask me now how long is good, I won't be able to give you a definite answer. I know women who are satisfied with 1 minute, 2 minutes, 5 minutes. Some women will like 1 hour and all of that. So if before he was performing 30 minutes, 1 hour, and it's gotten to 45 and he cannot, he needs to reassess his general health status. Is he able to do things that he used to do before and expecting to be performing at sex to the same way? Has he developed any health problems, high blood pressure, diabetes, and stuff like that? That needs to be looked at. But performing for long hours or for long, is generally not something that is desirable to many women. A few women I know, and even for a man, when you are performing during sex, you need to perform at a point, relax a bit, and go ahead. You lose steam, if you go long. And I'll tell you one thing, this is free advice. Most women get dry along the way, okay? So it's always good to perform, satisfy the woman, take a break, help her to recover, and then come back. And you do better. Women who have multiple orgasms from repeated sexual intercourse appreciate it better than, just being on a woman for so long. She gets dry, she's screaming and shouting, and you are happy. Most men will say, oh, I really gave it to the woman.
Okay,
but actually you've hurt her.
What are some of the measures that can be put in place? I can see some pumps. There are some images on the screen to help. What are these? Can you help us?
Okay, so these are people who have like a real mechanical problem with erections. So for instance, the person has diabetes, all their nerves are gone, the blood vessels are gone, or they had a spinal injury, so we know that the nerves cannot send messages to the penis anymore. We could, implant a pump into the scrotum or sometimes under the skin, battery powered or mechanical. Some of them you just have to actually hold a pump and pump it, which pumps either normal saline fluid into the penis or pumps air into an implanted tube in the penis, which helps the penis to get erect. And you use it for your performance. After that, you release the valve and the air or whatever fluid goes into that implantable thing, comes out, and then is the end. Next time you could use it again. So these are people who have permanent problems. So on the right of the screen, that's the pump we're talking about. Now we also have vacuum pumps for regular people who once in a while will have this problem, or maybe if it's a long-term problem. These pumps are vacuums, just like how a vacuum cleaner works.
Oh.
So you put them over the penis, and there's an end where when you pump, air gets drawn from the tube and drags the penis skin with it. Now that vacuum action pulls blood from your system into the penile tissue and then helps you to get an erection and keep it for the sexual performance. Sometimes you lose steam during the performance, go back to your pump it and all that. Most people don't do this in front of their partners. So they'll go into the bathroom and do this quickly and come. I'm saying this because a lot of people do not know how to discuss this with their partners.
Okay.
So you have a guy who has this problem, gets a girlfriend, maybe a new girlfriend, and he's been bragging the whole time, I'm going to do this to you, I'm a lion, I'm this and that. And then they get into bed, and then he realizes that, look, things are not happening. Next time you go and hide, or you avoid the girl, and the girl will be wondering, is there a problem with me? Do I have issues? And all of that. So today, we are trying to encourage men. You are not alone. 10% of men have this problem. The older you are, the higher the chance that you could have this. And there's help.
So they shouldn't
out
be
there.
shy about it.
Don't be shy. Just tell your partner, hey, listen, I have issues with erections. It's not a problem, okay? After all, we know that a good percentage of women don't enjoy sex through penetration. They like clitoral stimulation and the rest. And so once you talk to the woman and she goes, hey, even me, I'm not bothered about penetration. It relaxes you. Remember we said that the brain sends the impulses.
But the man won't get the satisfaction that he wants
he
either.
will.
How?
You know, your nerves are still picking sensation.
Okay.
So you could perform oral sex on him and all of that. And of course, if he knows that this is his problem and is working at it, then telling you and you being receptive and going on with maybe oral sex to satisfy you and the rest, he's okay. He's still maintaining his relationship with you while we are working at it. When the two of you seek help, it works much better than when a man alone goes to look for that help. All right. So just be truthful. Or if it's a problem that you are developing, on the background of good performance in the past, then you just tell your wife or your partner that, hey, I know I used to perform well, but these days I've noticed that it's not so good. Should we go and see a urologist? Should we see Dr. Senyo? Should we see somebody else? And you go for that consultation together. Most of the time, we see that men have erectile dysfunction because of performance anxiety. The man wants to perform so bad that he's so stressed that the brain is not able to comprehend what's going on and doesn't send the right signals, and so they might not get erection at all. So relaxation techniques are good, and that's where exercise also comes in. So for a man who exercises, sometimes yoga and the rest, you tend to concentrate more and your anxiety levels are lower, and so you get better erections. Now those who have medical conditions and erectile dysfunction is due to that, then the better you manage this medical condition, the better the problem or the situation will be for you.
Okay, so that's how we have to end today's segment. I wish we could actually get more into it. There are myths surrounding some of these things and all that, but I'm sure we'll do that for some other day or some other time. So that was the health segment. We discussed erectile dysfunction. So if you're out there and you have a problem, don't feel shy about it. You can just speak to your doctor who may help you. And if you do not have someone to speak to, you can contact Dr. Senyo. His your social media handles? DRSENYO, Dr. Senyo. DR Senyo on all social media platforms. Okay. So thank you so much, Dr. Senyo Misroame. He is a director of the Tantra Community Clinic. Up next is the entertainment segment, and Spiky